The biggest issues facing those who fall ill with COVID-19 is that their families can't visit them in hospital. And from the point of view of distressed relatives, they can't see for themselves how a loved one is doing. Mia Malan is the editor at the Bhekisisa Centre for Health Journalism. She joins us more on what's really a painful aspect of this pandemic. Mia, good evening to you. I mean, you've written so movingly about this. COVID-19 is a lonely illness. You can't visit patients in hospital. There must be huge implications.
Yes, I think the implication is that families find it extremely challenging to find out how their loved ones are doing, and that causes a lot of anxiety and fear. So if someone is, for instance, on a ventilator and sedated and therefore can't phone or text their family, the only way to get information on how the patient is doing is by phoning the hospital. But if you're not a close next of kin, they won't give you any information. And also, because family members can't go to the hospital, they never get to meet the doctor or nurses taking care of their loved ones. So they can't build up a personal relationship with them, and they also can't form an opinion of the type of care that a patient is receiving. And that all they can do is that they can have personal contact with a doctor over the phone or WhatsApp. But with COVID, of course, doctors are extremely busy, so they're not in a position to provide regular or personalized feedback.
I mean, you documented the story of one Cape Town family. They had a patient in a private hospital. What happened?
So it's a family with a sister and a brother-in-law in hospital, and they were both admitted to the ICU unit when they got to the hospital. And the brother-in-law is critical. He's still on a ventilator, and the sister was eventually moved to a general ward and then discharged. But when both of them were in the ICU unit and too sick to text or phone, their loved ones couldn't get any information about their condition. In fact, for the first 5 days after they were admitted, they had no contact with a physician who treated the couple. They didn't even know who he was. And during that time, the health staff argued that the couple, because they were married, are each other's next of kin. So they provided health updates about the husband to the wife, who was too sick to contact her family at home to relay those messages. And the hospital didn't want to provide any other family member who phoned for information with the information because they argued they're not the next of kin. And that made the family, of course, incredibly anxious.
Sure. I mean, what a difficult situation. Are there any solutions, Mia? I mean, I can't think of any. I mean, doctors and nurses, we know have to be very careful with personal information, but this must be such a lonely time. And imagine, I mean, it's one thing to be the family who's got someone in hospital. If you're in hospital, you must be incredibly lonely as well.
Absolutely. You will find that some hospitals in the United States, for instance, have people who donate iPads because people die that way. They don't die with their families. They have their last messages over an iPad. But this family in Cape Town now uses their GP to talk to the specialist who is treating the brother-in-law because they feel the doctor is getting agitated when he has to explain to them each day what is happening. So they think that he would respond better to another medical professional. So that's one solution. But of course, not everyone has the type of resources to pay a GP to do this. So another suggestion by the family is that a hospital needs to appoint someone to update families daily about their families, even if it's not a doctor, if it's just someone who can translate what the doctor says into easily understandable language.
Mia, this must be playing out in hospital wards literally around the world at the moment.
Yes, and this case study that I spoke about is in a private hospital, which you would imagine would be better resourced than a public hospital. But something in our private health care system that makes it even harder for patients is that because our system is structured in such a way that private doctors work for themselves, they don't work for the hospital, it's even harder to get information because they don't have a specific responsibility towards that hospital, as opposed to a public hospital where a doctor would work for the hospital and work as part of a multidisciplinary team.